a great question. So some of our patients have had more needs, feeling disconnected, financial struggles, health anxiety, and just kind of managing the collective trauma that we've all been through. However, interestingly, others showed reduction in mental health needs during COVID because of a reduction of social demands, we think, and ability to connect with others more freely through technology like Zoom. So what we've actually seen is that most of the challenges in our population are happening kind of now as people have begun to return to a new normal, social demands have returned to baseline. Those demands, coupled with new anxieties around COVID safety, particularly for immunocompromised or other vulnerable populations, has been extra challenging. We're also seeing from our team that our folks are really having to learn a new set of social skills related to social distancing, masking, physical distance, reading facial expressions in a new way. So we're noticing that kind of we're having most challenges coming out of COVID or coming out the other end to this new normal, and thinking about a whole new kind of social curriculum for our folks. So I wanted to quickly address the stigma that people should only go to therapy when something is wrong. Professional support is for everyone. Some people just need to talk to someone and a space to manage the kind of typical life stressors. And that is not only okay, but it's encouraged. However, if you're thinking, I'm not sure if I need support, the thing that I always think about is when experiences feel less manageable and are interfering with your lives, either functionally, so like you're unable to get to class or you're doing poorly in your job or class, or just kind of your quality of life, if you're just not feeling as happy or as motivated as you had been before. Some of the signs that we look for are changes in sleep, appetite, desire for social interaction or connection to other people, lack of desire for engagement in meaningful activities, specific life stressors, or if family or friends are kind of noticing differences in your mood, affect, or behavior. Those are all things to start to kind of pay attention to. One thing that the pandemic pushed us forward on was access to telehealth services. Although many clinicians have been overwhelmed by the pandemic, there are lots of ways to receive help now, which is really fabulous. So in-person, telehealth, and then apps and hotlines. And I would say, first of all, call a university or major healthcare clinics near you that specialize in supporting neurodiverse folks. If they can't see you, ask if they have a list of places that they refer to. One last place to check out is lots of disability or mental health specific websites also provide lists of practitioners who have been certified or vetted by them who have expertise in that area. So checking out websites is a great place to look also.